Have you ever sat in your doctor's office, told them clearly that you don't want that medication, and then watched them bring it up again anyway? Maybe it was a statin, maybe it was a blood pressure pill, and you're thinking, did they hear me? Do my wishes even matter here? Today, we're going to talk about why that happens, and it's not because your doctor doesn't care about you. The answer is something called metrics, and the research on how they affect your care is eye opening. In medicine, metrics are measuring tools, checklists, and benchmarks that hospitals, insurance companies, and government programs use to judge how well your doctor is doing their job. On paper, that sounds like a good thing. Who wouldn't want accountability in healthcare? But here's where it gets complicated. A landmark study published in the New England Journal of Medicine by researchers at the Hospital for Special Surgery looked at 86 performance measures used in Medicare's merit-based incentive payment system, the program that literally ties doctor reimbursement to hitting certain targets. Their conclusion? Many of those measures failed basic validity tests, and in the words of the lead researcher, bad quality measures can be harmful. They found that some measures might actually do more harm than good, especially in older or sicker patients, yet doctors are still financially incentivized to follow them. Here's something most patients don't know, and most doctors don't say out loud. In many health systems, a physician's bonus at the end of the year is tied directly to whether they're hitting those metric targets. So when your doctor recommends a statin and you say no, you may literally be affecting their paycheck, not because they're greedy, but because the system has been built that way. A study published in PLOS One by researchers studying physicians across California, Massachusetts, and New York found that escalating performance demands placed on physicians combined with shrinking autonomy directly endanger the quality of patient care. When doctors can't make individualized decisions for you, patient outcomes suffer. And a major 2025 survey by the Physicians Foundation polling over 1,000 U.S. physicians found that 9 out of 10 doctors say the loss of clinical autonomy is a major threat to American medicine. 7 in 10 personally know colleagues who have left the profession because of it. The survey's president put it plainly: patients are paying the price when physicians lose the ability to make timely, independent decisions in partnership with those they serve. Now let's talk about what this does to you, the patient. A peer-reviewed paper from PubMed Central on the doctor-patient relationship found that when patients feel unheard, disrespected, or out of partnership with their physician, poor health outcomes follow. That's not just a feeling, it's a measurable medical reality. A 2020 qualitative meta-synthesis, meaning researchers combined the findings of multiple studies published in Healthcare Professionals' Perceptions of Pay for Performance, found something that should concern every patient. Doctors themselves raised the alarm, saying the more templates that get introduced, it takes away the clinician's freedom, and that sort of rapport that you can build with a patient is much more difficult when you have to go through set questions. That was a general practitioner speaking anonymously in a research study. Your doctor may feel the same way. And a study in the Journal of General Internal Medicine confirmed that the benefits of pay-for-performance programs tying physician pay to metrics remain unproven, while the risks to individualized care are real. Now, dot here quotas, the core tension. The system is built around population-level averages, but you are not an average. You're a person with a history, preferences, side effects you've experienced, and values that matter. A study published in PubMed Central, specifically looking at pay for performance and patient autonomy, found that patients' thresholds for accepting medication, weighing risks, side effects, and personal benefit often don't match what clinical guidelines assume. In one example involving stroke prevention drugs, the number of patients needed to treat before one person benefited ranged wildly from 9 to 100 depending on the individual. Yet the metric treats everyone the same. The study asks a pointed question: does tying quality to reimbursement inadvertently pit financial incentives against patient autonomy and trust, the cornerstones of the physician-patient relationship? And research from the UK's implementation of pay for performance over 8 years found that while the programs gained acceptance among doctors, they had a negative impact on clinical autonomy and led some physicians to prioritize their own pay rather than patients' best interests. Those are the study author's words, not mine. So what do you do with all of this? First, don't blame your doctor alone. They are often caught between a system demanding compliance and a patient demanding to be heard. Many of them hate this as much as you do. Second, know your rights. You have the right to refuse any medication or treatment. Your doctor is required to document that conversation, and a well documented refusal is not the same as a doctor failing a metric. Third, ask the right question. Next time your doctor recommends something you've already said no to, calmly ask, is this something the guidelines require you to bring up, or is this your personal clinical recommendation for me specifically? That question opens a very different conversation. Fourth, find a doctor who practices shared decision making. Research shows it leads to better outcomes and stronger trust. If your provider won't engage with your preferences, you deserve one who will. The metric system was designed with good intentions, but good intentions don't always produce good medicine, especially when the person sitting across from your doctor is you, with your own history, your own experiences, and your own right to decide what goes into your body. You deserve a healthcare relationship that honors that. If this video made you think, share it with someone you know who has felt unheard at a doctor's appointment, and drop a comment. I'd love to know your experience.